Hi everyone, welcome back to my channel. I am Dr. Shalu Punj. Today we are discussing a very common body feature that many people ask about, hip dips, or as they are sometimes called as violin hip. If you have ever felt self-conscious about these inward curves between your hip bones and upper thigh, this video is for you. Let's talk about what they are and why do you have them and what are the options to correct them. First, let's define them. Hip dips are natural indentations or inward curves that can occur on the side of the hip. Think of them as a gentle, subtle dip in your curves. Many people desire that the classic smooth hourglass figure, but it is important to know that hip dips are perfectly normal and there is nothing anatomically wrong in having them. They pose zero medical risk. However, I know that for some, these hip dips can cause self-consciousness, especially if you are striving for a smoother curve. Now coming to the topic, what causes hip dips? The main cause is anatomy. These dips happen because the skin is more tightly attached to the trochanter, which is a thigh bone. People with naturally tall hip bones often have more noticeable dips. The way fat and muscle are naturally arranged around the hip and the thigh determine how much indentation it will show. And thirdly, genetics. Options for corrections. If you wish to achieve a smoother and a more curved silhouette, there are three primary cosmetic solutions. First is fat transfer, that is a lipofilling. This is a popular 2-in-1 procedure. We gently suction out the fat from the area where you have little extra, like your tummy, inner thighs, and then inject it directly into the hip dip. This natural fat fills the indentation, create the beautiful and smooth sculpted curve. It's often called lipofilling or fat grafting for hip dips. Second technique is dermal filler. It is a non-surgical option and we can use dermal fillers to temporarily add volume and smooth out these indentations. It is a great option for those who are seeking for a less invasive approach. And the third one is hip implant. Though it is a less common for hip dips, specifically implants can be used to add significant permanent volume to the hip area. Let's focus a bit more on the fat transfer, as it is the most common and effective technique for permanent solution. The procedure involves daycare surgery, meaning you don't have to stay overnight. We use general anesthesia to ensure that you are comfortable during the procedure, you don't feel anything. The fat is carefully grafted into the area with the goal of smoothing out the hip curvature. Now coming to aftercare and recovery. After the procedure is done, after you have stayed in the hospital for 2 to 3 hours after surgery, you can go back home. Expect some bruising and pain for a couple of weeks at both liposuction areas and injection site. You can see the result immediately, but it can take up to 6 months for the fat that we have grafted to settle and the new curve to become visible. So remember, hip dips are normal. They are just beautiful part of human anatomy. But if you feel that achieving a smoother curve would boost your confidence, they are safe. If you are considering the procedure like fat transfer, for hip dips, the most important step is to book consultation with a qualified plastic surgeon. We can discuss your goals and determine the best suited plan for you. Thank you for watching. Don't forget to like this video and subscribe for more educational content. Leave your comment below if you have any questions regarding this topic. Thank you.